It's really a great pleasure to see this room filled. And at the risk of being too informal, it's lovely to see many of you for the first time with your clothes on. So welcome. This is a joke that really only a GI doctor can tell. But my name is Swati Patel, and it's really special to welcome you all to this educational event on Lynch syndrome, particularly today, which is the cap off of Hereditary Cancer Awareness Week. And so it's a true honor on behalf of my course co-directors, Jessica Berman, Michelle Springer, Lisa Naxel, and Lisa Koo, to welcome you all. You will be hearing from all of us throughout the day. I will say that we are a bit disappointed that Jessica was unfortunately unable to join us today. She came down with a cold last night, but she's tuning in and is here with us in spirit. This conference, and many of you have already come and given us feedback on how wonderful the space is, how well it's organized. All of those things would not be possible without this outstanding University of Colorado Cancer Center team. Please give them a great thank you when you see them. Every small detail that's been attended to is because of the hard work of these individuals who really aren't necessarily paid to work on a Saturday, but are here because they support the mission of the University of Colorado Cancer Center and share our passion for cancer prevention and treatment. So if you see them, find them, congratulate them, maybe hand them a cup of coffee, they might need it. A very special thank you. This event would not be possible without the generous support of the Karen K. Wachtel Memorial Fund. This fund was established in honor of Karen K. Wangerud, and with the goal of really supporting educational events like this in genetics. We're really, really lucky to have Ken and Kira, Karen's family here. Ken and Kira, please stand up. We can't thank you enough for generating all of the support for this fund to really support this important event today. We also must thank all the experts that we have today, particularly those who have traveled from afar to be with us, including Dr. Patrick Lynch, who will be our keynote speaker. We have a series of speakers throughout the day on many topics related to Lynch syndrome. Again, we are very, very grateful and thankful for them to spend their Saturday with us. A really important theme throughout today is that this is about you. This is about patients, our community members. And because of this, we really emphasize the importance of the strong patient voice at the forefront. And hopefully you'll see that throughout the day today and feel comfortable and confident enough to be engaged in conversations throughout the day. We have multiple important patient advocacy organizations in this space who are here, including the Jacqueline Rush Foundation, Catch It in Time, Fight Colorectal Cancer, Connect My Variant, and the Colorectal Cancer Alliance, who, as nonprofit organizations, were able to still be here and provide us support to be able to have this event. And at lunchtime, we'll be hosting a very nice patient advocacy panel where we can all learn about what their organizations do and how to get involved if interested. We also have several corporate sponsors to thank. These are the really entities that we as clinicians partner with to deliver the highest quality care to our patients. For those who had coffee and breakfast, we have Grail to thank. This evening, this early afternoon, once we wrap up, we will have a nice cocktail reception on the rooftop, and hopefully the weather will clear up for us for some beautiful views of the mountains in downtown Denver, thanks to Ferring Pharmaceuticals. Also would like to thank our bronze level sponsors, Janssen Oncology, Medtronic, Myriad Genetics, and our pearl level sponsors, Cook Medical and Invitae. Please take the time to learn about these our organizations during the breaks, during lunchtime. If you have had polyps removed, go find out what tools are used to remove those polyps. If you're curious about how artificial intelligence works in colonoscopy, you can learn about all of that. Just a few housekeeping items. If there's any questions, issues that arise throughout the day, please find any one of us course directors, the Cancer Center team, And of course, their fearless leader, Ashley Boshovan, if you need any assistance with anything. If you do have a laptop or a device that you'd like to connect to Wi-Fi, there's an open guest Wi-Fi network, CU Anschutz guest. You just have to agree to the campus network policy and connect. Hopefully everyone used the parking code to park in the Vail, Snowmass, or Monte Vista lots. If you have any questions or issues around that, Ashley or someone from the team can help. Make sure, if you haven't already, to pick up your attendee bag. There's some helpful information in that bag, some paper if you would like to take notes, as well as QR codes that can lead you to our feedback survey, because we will want to hear from you on what you liked about the conference, what you'd like to see next time, if you'd like to see it next time. And then, of course, we're really, really pleased to share that all of the presentations today will be video recorded, and we plan to make these openly available to not only everyone who's registered for the conference, but our wider patient community. And so please stay tuned for more information on that. Once we have those videos organized and a place where they can be accessed, we will communicate that to the registrants, and you're free to share that with anyone in your friends or family or community that you would like to. So the symposium today is structured as such. We'll start with our keynote presentation, and then we have 3 sessions dedicated to kind of different domains. The first on our best practices in decreasing cancer risk in Lynch syndrome. The second, really focusing on how we can engage with our family, our community. And then the third session, really kind of looking at the most cutting edge treatments in Lynch syndrome cancers. For each session, the speakers will give their presentations in succession, and then we'll have ample time for a nice panel discussion where we really will encourage a lot of participation from you all. And to really spark that, what we'd like to do is use this audience response system. So I'd like to just take a pause here. Please take your smart device out. This is the time where it's not rude to take your cell phone out at the table. So take your cell phone out and go to your text messages. For the recipient number, put in the number 22333. So that's the number you're texting, 22333. And then in the body of the text, you'll learn how to spell Ashley's last name. So it's Ashley Boshovan 513. That's the body of the text. Dr. Lynch, I'd like you to do this too. Okay. So throughout the day, we'll have reminders on, what this code is, what the text message is, but once you do it once for the day, you don't need to do it again. And it'll just allow you to participate through the panel discussions and the sessions. So to start off, we'd just like to learn a little bit about each other, about who all is in this room. So we'll test this system out a little bit. Let's see if we can get this to project. Perfect. So let's, sure why it does that. So we're working out some of the projection issues, but it should still be able to capture your responses here in this mode. We just want to learn about what brings you to this symposium. You have Lynch syndrome, you can enter A. If it's a family member who has Lynch syndrome, enter B. Take care of individuals or do research, do advocacy work, part of industry, or some other draw to this symposium. So we can all see that the vast majority of individuals in this room are individuals affected by Lynch syndrome. So I thank you all for being here. And hopefully we all take away something that can advance your life, your care, and your family. So a follow-up question for those of you who do have Lynch syndrome, 65% or so in the audience, if you do have Lynch syndrome, do you know which genetic change you have? Is it MLH1, MSH2, MSH6, PMS2? Not sure, something different? There's some whispering, probably some conferencing going on among family members. That's perfectly acceptable. This is an open book test. So this is really insightful to know. Of course, these are de-identified and we don't know who's entering these responses, but just as we contextualize what we learned today about Lynch syndrome, and although it's been caused sort of or called a collective entity for a very long time, we'll learn that perhaps the issues that these genotypes deal with are just a little bit different, and our approach to taking care of individuals with these different genetic changes is customizing and personalizing over time. So we can go ahead and go back to the presentation format. So the format of the presentations are such, and again, I'll remind you that during the lunch, we invite everyone to grab their lunch and return if they'd like to for a really outstanding set of panelists that will talk about their patient advocacy organizations and how to get involved if interested. As I mentioned, we crave your feedback. This is the first time we're hosting this event. We'd like to learn from you as to whether it's worthwhile, whether you would like us to organize such events in the future, what topics you would like to see covered. This QR code will be displayed throughout the day. It's also on the printed agenda in your bag and the notes pages in your bag, and will be emailed to you. So please be honest and open with us because we organize this for you.